All right.
All right. So, Omar, you are in Franklin? Is that right?
Yeah, Franklin, Tennessee. It's just outside of Nashville, one of the southeastern suburbs.
First off, kind of unrelated, Nashville, that area has seen some craziness in recent weeks. How are things going there with your friends and stuff from the tornado damage?
There was a lot of craziness, you're right. And things are not back to normal, but I think the worst of it is probably over. But now it's just a period of rebuilding and trying to get people back on their feet.
Yeah, I mean, it's kind of a punch in the gut there with everything else, that happened there. That community is still reeling from that.
Yeah.
All right, let me jump into some questions here. I'll start at the top here.
I'm going to move out of view, but I'll be right. I'm here listening to you.
Okay, well, that's such a cool painting or photograph. I can't tell. Is that a painting or a photograph there of the lion?
It's a photograph of a lion.
Man, that's beautiful.
Thank you. I've got a malfunctioning door that I had to fix to keep it closed because I've got kids listening to something. So,
yeah.
All right.
Everybody's staying put, and yeah, they have to be listening to something here.
All right. Okay, I'm good.
All right, so Omar, here's a question. I'm just going to go down. It's going to be a little bit of back and forth because I'm going to just go down the list. First question from Cynthia Brown down in Florida, Panhandle there. She wants to know, do you believe the swab tests are accurate?
I do. I think that the tests are good and accurate.
Okay, so I've heard the term like what is it, a preemptive positive or something like that? What does that mean? And so there's a positive, but then it has to be tested elsewhere. I'm not sure what's going on there.
So the tests that I'm aware of, I know they have some drive-through testing, but the testing that I have access to through the emergency room takes about 4 days to actually come back. We swab the patient, and the technique is actually the most is the thing that the test's accuracy is most dependent on. Just making sure you get a good sample. And once that's done, we package it up, send it down to Atlanta. They run it and then send it back to us. So the tests aren't getting done in a local facility. Now, some of the private corporations, that's for the, like an ER. Some of the private corporations like LabCorp or Quest or some of the other labs, I think, have the capacity or capability to do it in their own facilities. But they, like blood work, they'll batch it and send it to their lab wherever they might be, they'll FedEx it overnight.
Okay, so I am going to jump down because there's a related question there. And while I'm doing that, I'll ask you one that I have from that. When people go get tested, one of the fears is, okay, here's somebody that's been testing people that are suspect, right? So you have possibility of active virus. You've heard about it lingering in the air and things like that. How safe is it to actually go get the test? And are you exposing yourself? I know that's not a perfect science, but
yeah, that's a good question. And I don't know. It depends on the cleanliness and, again, the technique of the testing station and the tester. Of course, a lot of people want to be tested, but the question I have is really why? I mean, what difference is it going to make? Because we don't really, now we have a cure, I guess, with chloroquine, but unless somebody's really symptomatic, there's really no reason to get tested. But if they're symptomatic, it's a good idea to get tested now, since chloroquine and azithromycin seem to shorten the course of the disease and lessen the impact of it on a person's state. So I say all that to say, anytime you go into an area where there are sick people, your risk of getting sick increases. That's why we don't like keeping people who have an immunocompromised state in a hospital if we don't have to.
Excellent point. So there's okay. So on the heels of that, let's see here. I have a question. Axa, who's in town here, a wonderful woman of faith. The woman is just filled with the Spirit and does some cool stuff. Why is it taking so long for the U.S. to get results back? Even developing countries in South America have fast testing that comes back in hours.
Yeah, I don't know. I'm not sure. That's a good question that I don't have an answer to.
So what you said earlier was when you guys, like an ER, you get a test, you have to send that to Atlanta, to the
Right.
Center. Is it Center for Disease Control that's doing the testing there? Or?
Correct.
Okay. Yeah.
Correct.
I mean, I guess you don't want to be sending these swabs just anywhere, right? I mean,
Right. That's true. And right now, there was the limitation was that we didn't have a lot of tests. So they were controlling them, and they were sort of the central repository of where we were actually getting them tested or resulted. But I think as we get access to more and more, then we should be able to expand the places that we're testing and the rapidity with which the tests are done. And, it's all a matter of sort of, logistics, I think. From my understanding, I think we had also even run short of the proper swabs to use for the specific test. And I saw some story that we had some big military planes bringing in swabs from Italy, of all places.
wow. Yeah, this is it's unprecedented. So the access to things is, has to catch up, right? There's not it's not like we have a million of these things sitting in a warehouse somewhere. Oh, let's pull out the swabs. Okay, so I had a question myself about origin because, whenever you get something like anything like this, there's all kinds of theories and, some of that stuff is just so crazy. But I was reading an article and it said that a company was starting to develop a vaccine based on a DNA sequence, and they were able to create the virus to work with it and try to find a vaccine. So I that caused me pause there. We're actually able to create, is this true, like manipulate a virus's DNA to develop that, to work with it? Is that possible?
Sure, it's possible. I don't know exactly what you're talking about in terms of the actual story, but yeah, I mean, genetics has come a long way, and we can actually, even with like CRISPR technologies, cut out and insert various genetic fragments into our own human DNA. This particular virus is not DNA. It doesn't have DNA. It actually uses RNA for its nuclear codes. But yeah, we're able to extract that and manipulate it and break it apart. But for immunizations, what we're probably really looking at are the antigens on the surface of the virus, like the S protein, the spike protein, that glycoproteins that are responsible for attaching those to our cells.
Okay, gotcha. Now, I remember way back in school, it was probably, it may have been college, but to where someone said that a virus doesn't actually meet the requirements for a living organism.
Correct.
That's
right.
It's a strange phenomenon, honestly.
So yeah, it's really just a packaged protein genetic code, but it has no organ systems, it has no metabolism, it has no ability to reproduce. So it's not a living organism. It has no life capacity, but it has the ability to transmit genetic code into living organisms and basically take over their cells and systems.
So that is like that's a philosophical, spiritual, all kinds of conversations could go into that one. So I'll get back to the more practical. We can maybe revisit that another time. Let's see. Shelley Vivian said, no questions, just tell them hi. We appreciate the insight.
Thank you.
They're down in Australia where it's not so bad yet, she says.
Fantastic.
Jessica Morris wants to know, are there any, and this is a very pertinent to her conversation, are there any cause or effects to breastfeeding mothers?
No. No, so, I actually had that question that I fielded, I think on yesterday or the day before yesterday's Facebook Live. Um, so this is not a gastrointestinal virus. It doesn't get passed through breast milk. And even if it did get passed through breast milk, it's a respiratory virus. And if the child swallows it, it's not going to be affected. But if mom is infected and she's breathing on the child as he's nursing or she's nursing, then of course that's a problem. So if mom is infected or has been exposed, my suggestion is just self-isolate. It's hard, but just don't get near your child. So that would preclude breastfeeding.
Okay, cool. A follow-up question from her was, considering the high amount of antibodies, could this be a good protection for the child, like the breastfeeding?
Not necessarily for this particular virus. I think in general, yeah, breast milk is great for establishing immunity for those things that mom has been exposed to, but mom's never seen the coronavirus, so she doesn't have any antibodies against it. So she can't transmit any of those antibodies, which she doesn't have, to the baby.
Yes. All right. Excellent. All right. So what are the concerns to face after the virus has been controlled, as there is no cure? How long should we truly wait for social gatherings after?
Yeah, good question. So, this has happened throughout history. This isn't anything new. It's not anything that's never occurred before. We just faced it just a few years ago here in the United States with the previous coronavirus epidemic or pandemic, which was the SARS-1, right, in 2002, 2003. Mm-hmm. Same story, same type of thing, just a different coronavirus. What we say is once the virus stops spreading, it's probably a good idea to wait 2 or 3 weeks to make sure that nobody else is around that would spread it. Just let it run its course. So I think, let's just, at the outer level, let's just say 30 days.
Okay. Lynn asked, just because I'm 60, am I that much at risk? Like the age factor?
Yes, because of the receptors that the virus is attracted to are increased as we age. They're the ACE2 receptors in the lungs on the pulmonary cells, the angiotensin converting enzyme 2. So they get upregulated as we age because they get less efficient. So there are more. So there are more docking stations, so to speak, for the virus as we get older.
Wow, that's pretty specific. That's amazing. I mean, it's fascinating, right? All this is fascinating. It's a lot of tragedy is actually fascinating. All right, David Wegener asked, does he think the U.S. supply of chloroquine is sufficient for the coming onslaught? If not, what are the chances of having the government prosecute people who import it?
Nice.
We're going to check now with the illegal team. That's Dave. That is Dave. So I guess the question is chloroquine. You mentioned, it was interesting. So a couple of people have asked. Someone said that chloroquine equals voodoo. Paul Mills, you may know Paul. I don't know if he's not in my circle there. I'm not sure.
Yeah, I know. So Paul, if it's the same Paul Mills as I know, he's a Green Beret. The Paul Mills I know is a Green Beret medic that I've worked with, and he's excellent, great guy. If that's the same guy.
Okay. His first comment was China virus, which made me laugh.
Yeah.
So let's see. We asked about getting results back, and I think some of that is just we have a large country, a lot of people. Some of these smaller countries, it's just logistics, I think, probably, right, that helps some of that. Amy Fivesh says hi.
Yeah, hey, Amy.
She said, you're a brilliant man and doctor. So I asked her a follow-up question about the scene in Memphis, and she said they're, doing the no visitor thing, all the restrictions in hospitals, which I'm sure you're seeing everywhere.
Right.
Is the virus mutating? Before they were saying that this is from Heather Pittman. Before they were saying that it was mostly affecting people over the age of 60. Just this week, 2 of my friends have tested positive, and they are my age, 40-ish, which, there's a difference between being at risk and actually getting the virus, right? It can age puts you more at
Right.
risk. But,
Right. What we're talking about when we say at risk, we're talking about more severe disease and fatality from the infection.
the mutation thing. So suppose the virus runs it, which it will, right? Basically around the world at this point, it's going to run its course.
Right.
There's a flu shot every year, right?
Mm-hmm.
So how long does immunity last to an outbreak like this? So it runs its course. How long is a person immune after that?
We're not sure exactly. It really depends on, there are a lot of factors that it depends on. Some diseases we have almost lifelong immunity to when we get exposed or have the disease, like, childhood chicken pox. I mean, that goes for decades, right?
Yeah.
Other diseases, because we don't really have exposure other than through immunizations, like with tetanus, those boosters need to be repeated every 5 to 10 years. So with actual disease exposure, we have a better immune system response and memory cells and antibodies. But over time, those things degrade. And after a while, without a subsequent exposure, our body starts, losing the attention or the focus it had to that specific disease. Another exposure would boost it. But I don't know, after a certain number of years, in some cases, it may be like they had never been exposed before, depending on what the disease is. I mean, smallpox, for example, most of us our age, we got a smallpox inoculation when we were, 3 or 4 years of age or somewhere around there. And we have those little spots on our arms that our kids today have no idea what those things mean. But we're still, from what I understand, still pretty much immune to smallpox, but it's been eradicated now. So, but other things we have to get boosters for.
Okay, that makes sense. And the more prevalent it is, the more chance you're going to bump up against it at some point sooner when you are still immune, and that kind of keeps your body prepared, I guess, right? So, okay, right. That's fascinating. Okay, I had a question. Oh, wow, I'm getting some flowing here now. So, I have SVT. This is from Jamie Newton up in Virginia. I have SVT and a heart arrhythmia, allergy-induced asthma, and hypertension. All pretty well controlled with medication. Being that I'm only 32, does this make me considered high risk or no?
Well, at some level, yes. So it doesn't necessarily put Jamie at higher risk of overwhelming infection, but mainly a higher risk in terms of her ability to fight off the disease should she get infected and end up with more severe symptoms.
Let's see. What is your take on black elderberry extract?
I've been reading a lot about that lately, and I think it's great. I mean, just like anything else, vitamin C, vitamin D, zinc, garlic, etc. It's not a magic potion. It's not going to protect you from not getting infected, but I think it would help boost your immunity so that you have a more vigorous immune response. Mm-hmm. But it's not going to be like a magic cape that makes you invincible and immune to the virus.
Is there this is for a personal question here. How do you make the stuff less sticky if it gets out of the bottle? That stuff, it's like worse. It's worse than honey. It's worse than honey. Let's see. Okay, so there was a question about cytokine storm, what that is, and what the complications could be for someone exposed to the COVID.
Yeah, so there is an inflammatory cascade that once the immune system recognizes a foreign antigen, it initiates a reaction that calls all the cellular responses and humoral responses or antibody responses into action. And there are many different compounds in the body that are involved. So it's like, a call to arms, so to speak. The cytokine reaction is primarily, has to do primarily with interleukins, like interleukin 1, interleukin 6. Those chemicals or chemokines that are responsible for creating inflammation, making membranes more permeable, allowing blood vessels to open up a little bit to allow cells through the walls so they can come fight, like macrophages and things like that, come out of the bloodstream into the tissues. So those types of reactions are necessary, but at some point, occasionally we get, sort of like what we would call a storm, where it's just too much, and it causes a lot of swelling, a lot of fluid in the tissues, especially, when it gets into tissues that are organ tissues that are functional, like lungs, pulmonary tissues. It can cause a lot of fluid in there that would suffocate us. So we want to be careful with, with medicines that might help subdue that without necessarily blunting the immune system effect. And it's a delicate balance sometimes.
Yeah, that's I've heard of some reports of that being one of the concerns with the lungs, because of course, if there's an overreaction, it's not just like it's an infection, it's
Right.
your tissue swelling. And okay, thank you. That was a very very specific question. So it looks like that's it. Your friend maybe with the China virus comment. I don't know. I want to ask you about that, because that's just it's a humorous thing. It's funny. It cracks me up when he says.
Well, I have a friend who's Chinese in Vancouver who actually wrote a post, and I reposted it on my wall about people getting upset and calling Trump racist because he calls it the China virus, and that's not racist. I mean, I think he made a good point that it's from China. I mean, so it's like, saying that I like Chinese food is not being racist. I mean, it's food that is specific to the Chinese people. So, but what he said, Will Steve's his name, what he said is that he believes that Trump, and he goes through an entire argument for this, but his point really is that he believes Trump is really trolling the Chinese Communist Party because they've been trying to put out messages that this is actually a bioweapon made by the United States to take China down. This is some conspiracy that started in the United States, and Trump's basically, I think, laying it back in their lap, saying, I got your number, and it didn't start here; it started in China.
Yeah.
So I don't think it's a racist comment. I think it's him just trolling the party there.
Yeah. Yeah, I believe that as well. All right. So today we heard a lot of possibilities for combat. We heard about, of course, developing a vaccine, the chloroquine, and then that's fascinating there that you would use like an antibiotic a specific one would even make that more effective. That's fascinating. I've been looking forward to seeing more on that. And then some of the other antivirals, you see different countries coming out with different options. So that's, what do you see? I also saw the plasma, the blood plasma. So you take someone who's recovered and use their plasma to basically insert some memory cells. So what do you see as being the most immediate help? Not a silver bullet, but the most immediate help that could actually get to the market soonest and actually be helping people.
avoidance, self-isolation,
Okay. Okay.
quarantine.
All right. All right.
Aside from that, I think, chloroquine and zithromycin seem to be pretty effective if that single study is accurate. And it's a medicine that we've had for decades, right? I
Yeah.
mean, we've used
Yeah.
chloroquine forever. When I was in Afghanistan with the Army Special Forces, that's what we were using. Between that and, we'd use either chloroquine, primaquine, or mefloquine. I mean, a lot of people, were using mefloquine. And that gave some people nightmares, and, pilots weren't allowed to be on it or any of that thing. But the chloroquine's different. And it's not really attacking the virus or the cells, but what I understand is that it is reducing the inflammation cascade, or the cytokine storm, so to speak, similar to what my opinion would be of non-steroidals, which now, though, we're saying there have been a couple of patients in Toulouse, France, that a case study came out of, case report, that said don't use ibuprofen because it can worsen the disease. But it would seem that it would also reduce inflammation and the cytokine storm and the inflammatory cascade through, like I was talking about yesterday, the conversion of arachidonic acid to prostaglandins through the cyclooxygenase enzyme that does that conversion. And by blocking that, it seems like it would help reduce inflammation and swelling and fluid.
Okay. So yeah, that makes sense. And I understand the general feeling that, you take a non-steroidal anti-inflammatory drug and it's going to it's going to curb the fight a little bit. But my understanding is with this disease, the fight is one of the things that is what gets you in trouble in the lungs. Is that correct? Or
it can, because also of, blocking the bronchial tubes, causing mucus plugging and resulting in a bacterial co-infection or superinfection that is basically pneumonia. So I think that's what the azithromycin or Zithromax is for, is to block pneumonia and kill those bacteria so they don't infect the lungs, while the chloroquine blocks the inflammatory cascade that allows the lungs to stay free and clear.
Okay.
And that's the proposed method of, I think, how this is sort of working.
Okay. And then one last thing, and I think from one of your earlier answers, know the answer to this, but culturally, how are we doing and what should we be doing?
Yeah, culturally. So I think, there is a difference in culture. We've seen the Chinese rates actually go down. And I think for two reasons. Governmentally, they don't have much of a problem locking people down without, concern for individual liberties, right? Mm-hmm. Because the state comes first. But also culturally, I mean, that's the way people are raised in the East, right? Not just in China, but all over Asia and the Middle East, and is in Africa. And that is that the family comes before the individual, and the community comes before the individual, and we make individual sacrifices to benefit our families and other people. The whole honor-shame concept too. Here in the United States and the West, including Europe, we're more individualized, and we tend to be more focused on personal growth and personal effects of the environment, and we're more concerned about how is this affecting me, not so much my family, my neighbors, my community. So when we look at quarantining, it's something that is difficult everywhere, but it's easier in cultures that think more communally rather than more individualistic. And it's also easier with governments who tend to think more about in a socialistic framework of, the government, the state come first, and will sacrifice individuals for the purposes of the state, versus what we have here in the United States, which is the government is merely here to support us to fulfill our desires and our dreams as individual contributors. So how does that translate? I think, I'd been hearing earlier in the week that we were about to get a national lockdown, both in terms of public transportation as well as quarantining. But then I was surprised that the president came out Wednesday and said he's putting it back in the laps of the American people, saying, here are our guidelines. We would appreciate it if you would, we encourage you to follow them strictly. And he didn't make any threats or assumptions or saying, if you don't, this is what's going to happen. But he said, it's very serious. This is what we're requesting you do. Please do it. But now we see at local levels and at state levels, we started off with cities being locked down by their mayors like San Francisco. And now we're seeing governors of states like in Maryland and Pennsylvania, Louisiana, and now California, as of about an hour ago, California's been fully quarantined by their governor, Governor Newsom. So thankfully, constitutionally, we worry about federal mandates doing that. But I think the president has gotten a little lucky that even these Democratic governors are actually locking down the states and he's not having to. But at some point, if all this continues, he may have his hand forced and may have to say, you know what, we're doing a national quarantine for 6 to 8 weeks.
Yeah, that's good insight. And I understand that because once the government takes over some control of something, they don't like easing up on it. It kind of sets a precedent. But yeah, I agree that at some point, you never know. Drastic times call for drastic measures. All right, so I didn't want to leave this one untied. So David Wegener had asked about the chloroquine quantity. Do we have enough in the country on hand?
Yeah, I don't know. I know that Bayer Pharmaceuticals, I believe, is the pharmaceutical company that produces chloroquine. They can usually ramp up pretty quickly, and I don't know where their facilities are that produce this particular drug, whether it's in China or Puerto Rico or here in the United States. And if it's here in the United States, I think we're a lot more likely to be able to pump out as much as we need pretty quickly. I understand that, I forgot where it came from, but I heard today that 3 million pills were delivered to the United States from somewhere. That sounds like a lot, but it's really a drop in the bucket. I mean, we have a population of over 300 million. And assuming that, Germany, Merkel said several weeks ago that she estimated 70% of her citizens would get infected. So, 70% of 300 million is going to be what, about 200 million, I guess, right? So that would be huge. And you think about 3 million pills trying to cover 200 million people. I mean, that's gone in a heartbeat. So,
which is why a lot of the emphasis is on helping those people who are in the most dire situations and not just running out and trying to get something that you don't need yet. So,
yeah.
Well, thank you so much, Omar. This is some of the best information I've seen. Is it okay if some of the people that see this follow you on Facebook? I know you don't,
of course.
Friends, at least follow them. Okay, leave them some room for friends. Because I think there's still a limit on personal accounts. But do follow because Omar gives some fantastic insight, both practical, like you've seen tonight, and philosophical. And I appreciate you, brother, so much, and I appreciate you taking time.
My pleasure. Anytime.
All right. Look forward to talking to you again. And but always good to see you.
Sounds good. And also follow me on Twitter. That's sort of where I think all this started last year with the abortion tweeting.
Okay.
So I'm just at Omar Hamad, and then of course also on Facebook and Instagram.
Okay. All right. So what's your Instagram?
Same thing. I think at Omar Hamad, I believe.
Okay. All right. I'll put some links.
Great. Sounds good. Thanks, Jimmy.
All right. Thank you, buddy.
You bet. See ya.
Bye.